You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to another episode of the RN Mentor podcast. I have the great pleasure of having Reginald Bannerman with me this week. He is the Director of Nursing and Service for Psychiatry. Reginald has over 31 years of experience in the healthcare field. He obtained his undergraduate and graduate degree from the Johns Hopkins University School of Nursing and an MBA from the School of Business. Reginald has been with Children's National Health System for over 15 years. He specializes in the area of reduction of the use of restraints and seclusion in the hospital setting. As the current director of the Division of Psychiatry and Behavioral Science, he has led his team to a 75% reduction rate in the incidence of seclusion and restraints over a decade. He is an expert in the area of seclusion and restraints regulatory competencies and managing aggressive patients. Reginald is also a certified senior crisis prevention intervention and autism spectrum disorder trainer. He is also a member of the Behavioral Health System-wide Task Force, which is tasked to work on initiatives to better serve patients and families on the mental health continuum. Reginald is also leading work in the area of managing the aggressive patient system-wide with implementation of the Behavioral Emergency Response Team. Reginald has presented his work internationally, served as a content expert on the American Nurses Credentialing Center on board certification examination at the nurse executive level, and he has several publications related to adolescence and mental health issues. Welcome to the show, Reginald.
Thank you, Dr. Ali. It's my privilege to be here with you, sir.
Thank you.
Thanks for having me.
Just call me Ali. That's fine.
Yes, sir.
I have a special place in my heart for mental health. Some of my own work is related to mental health issues with the veteran community. So thank you, first of all, for the work that you're doing. And I want to really get into, before we get into too much into your work that you're doing now, I want to know how you got into the world of nursing. You have over 30 years of experience in healthcare. How did you get involved in healthcare and in the world of nursing overall?
Yes. So I come from a family of, lawyers and doctors. So growing up, it was always, something that I wanted to do. Actually, I started off, trying to, go into medicine was my main goal. But I went to see my brother at school, and his roommate happens to be a male nurse. So it was like, whoa, can male be nurses? That was a big eye opener for me. And then so that started my trajectory, the funny joke is that I really took nursing as a joke, and it kicked my rail at the beginning. But, um, I'm glad that I took that path. I don't have any regrets, and the success that we've had, it's not just myself, but my colleagues that I've had the privilege to work on. There's always someone calling you working on a new project, and hopefully during this conversation, I'll tell you some other projects that I'm working on. But it's been a privilege, and I wouldn't trade it for anything.
That's fantastic. What was your experience going through nursing program and your evolution into your actual role as an RN, working, for example, bedside and the units you worked with?
Yeah, so I started off, from New York City. I went to Borough of Manhattan Community College. So I got an associate's degree first. But whilst I was doing that, I was also working. So I held a job like from 8 to 4. And then I took the evening classes at Borough of Manhattan Community College, for my associate's degree. Graduated in 1994. Um, but, like I always say to kids and everybody that I get to talk to, there's nothing that, is given to you on a silver platter. For some of us, including yourself, I'm sure, first generation, we have to work really hard, right? So, for example, I remember in the summer months, sometimes I would deliver newspapers in the morning, like wee hours of the morning. I go to the depot around 2 a.m., pick them up, go to Manhattan, start delivering. I mean, some buildings, 55, you're on the 55th floor delivering the newspapers. You do that and then come home, get ready to go to work in the morning, just so you can have enough funds to pay for your summer school and whatnot. So it hasn't been all like a silver spoon in my mouth, but working hard and believing in what you want to achieve as the end product, has been the way to go. And like I said, nursing has been great to me. At the beginning, again, like I said, I didn't take it that serious, not because I wasn't interested, but I was like, okay, well, I wanted to go to med school. So med school and nursing, nursing couldn't be that hard compared to, med school. And so if I'm already having A's and whatnot, and trigonometry classes, then nursing should be a piece of cake. But as you know, the material is quite extensive. Sometimes, you have to really sit down, buckle, and learn, right? So I wasn't really paying that serious until I took a couple of quizzes. I was like, whoa, you could do better than that, big man. And that was when I started to say, you know what, I really need to buckle down and get the job done, So it was nice that I got my rear kicked a little bit in my fundamental classes, but thereafter, it's just a matter of, staying focused and getting the job done.
That's fantastic. Where did you start? Once you graduated, what was your first job?
So my first job when I graduated, I finished my training in New York, and then I moved on to Maryland. And so once I was at Maryland, and it was kind of funny because I really wanted to work at Johns Hopkins University Hospital, Johns Hopkins Hospital downtown Baltimore. So I was communicating with the recruiter whilst I was still in New York, and so that was my first job. So I worked at the Johns Hopkins Hospital in Baltimore, 600 Wolf Street, mental health floor, Maya 5. So that's where it all started. And I was there for about 2 years. And then I got an opportunity to move up into a supervisor role from the inpatient to an outpatient. This was a substance abuse clinic. So what we did is that we gave patients that were using heroin, we gave them methadone, right, as a substitute. So we take their urines, make sure they are clean. The more clean they are, the more they don't need to come to the clinic. So they may get a 2 week, like they may come on a Monday and Thursday, Monday to, get 3 days worth, and then maybe Thursday or Friday come in and get the weekend's worth. And we could randomly call them and do a urine test on them. So I did that for about 3 years. Whilst I was doing that, I also got a chance. I was born in Ghana, West Africa. It's my country. I'm a U.S. citizen now, but I had a chance also whilst I was finishing doing that to go to Ghana in the year 2000 to do some work with some doctors from Hopkins. We did, travel to do some work in Ghana, and some of the people we went with were also from Ghana. So it was sort of like a mission thing that we did. And whilst I was there, it was like an epiphany. I was like, okay, well, now you got to, go back and try to get another degree. And so that was when, I went back. I mean, by then I already had my BSN, AA to BSN, and then I went back for my master's program. But it's always good to, sometimes leave the U.S. and whilst you're away, sometimes for me, it's a good time to connect, right? Because you recognize that people don't have a lot, but they are very grateful for what they have.
Right,
And
right.
then you recognize that, wow, I have all these opportunities and I need to take advantage and do something with it. So for me, that was one of the epiphanies that during that journey, I was able to say to myself, I need to do better and then try to reach out to help others.
That's fantastic. Um, uh, how did you decide and what area you're going to get your master's in?
Yeah, so that's a very, very good question. The moral of the story is that I think that once a nurse, always a nurse. I always believe that once I have my bachelor's degree done, I'm a registered nurse, and nobody's going to take that away from me. And it was a matter of growing, grow. I call it growth and development. And when I ask myself, I'm someone that I don't like when people say you can only do this. So if you tell me I can't do something, I say, watch me, right? So it was more like, well, I'm already a nurse. I need to diversify. I can't put all my eggs in one basket, So I wanted to do something, maybe an MPH, Master's in Public Health, or Master's in Business Administration. And as I thought about it more, I was also very fascinated with business in general. So I figured, you know what, why don't I just get my MBA? Because I know also here in the US, even the MBA alone, people are always like, whoa, they are very, very quick to say, wow, you have an MBA, So combining the nursing and the business aspect, I think it was a no-brainer. And then the last but not least, a lot of times when you hear nurses, they say we're touchy-feely, right? Like we don't have the facts, we don't have the figures. So I wanted to equip myself that when I sat at the table with other stakeholders, I want to make sure that I'm very well informed. I have the data, I have the evidence that I need to ask for what I need. And it's not about the feelings or the touchy-feely or anything of that, right? Because there's always this concept about, well, how do you balance business with safety and taking care of patients? And we have to recognize that we don't have infinite amount of resources. Our resources are limited. Therefore, it's a very fine line. You have to tread the needle. You have to balance safety with the business aspect. One can't be bigger than the other. And I think that there's a way to continue to do that.
Well, so have you? Because I know a couple of colleagues who've gotten their MBAs in lieu of going to a master's degree in nursing.
Yes.
How has that been beneficial in your nursing role? Because
Yes.
I'm going to assume you didn't open up shop somewhere and.
No, no, no. I think it's very, very good. I mean, so for example, just simple examples. Like, so I'm also very big on academia. So, like teaching and whatnot. And you recognize that some of the schools, if you want to teach, for example, if you don't have an MSN, they don't want to allow you, or they won't necessarily look kindly to you to teach, right? So, having a master's in nursing and health systems, I mean, that was my focus. I think that that's definitely something good that really allows me to also look at academia as possibly an option for me. From a business perspective, I think having an MBA, to be able to read a budget, understand the basics, right? And we talk about, yes, I don't own a business, say running a company, but I know how to read a statement sheet, tell whether the assets that the company has and what they owe, are they, in terms of their liquidity, return on investments and whatnot. You're able to have those kinds of conversations. And I'll tell you, for example, at Hopkins, they have the traditional MBA and they have the medical MBA. I chose to do the traditional MBA because I felt that I already know something about nursing in that arena. And I wasn't going to indulge more into the medical. I wanted to talk about, for example, a BMW, a Mercedes Benz. They make cars, right? But why? Why do they target certain segments of the of society? And in terms of, for example, at one point I remember Mercedes Benz really wanted to get into the U.S. market, and they ended up teaming up with Chrysler, which was a really bad investment for them at the end. But they were so determined that they were looking for any opportunity to get into the market. And it backfired on them. At the end, they had to get rid of that portfolio. Their Mercedes Benz portfolio was doing very well, but the Chrysler portfolio didn't do that well. And they had to get rid of it. So for me, again, as I think about, business and nursing, I think I enjoy when every day I look at the stock market. I'm looking at Apple, I'm looking at Google, I hate not to bring it up. My own 401k, I manage it myself, and it's kind of neat when you look at it and you see whether the stock market is going up or down. And funny story, I told a colleague of mine, buy Apple. before they did the split recently, and it just blew up. Within 1 year, it went up almost $150. I don't do stock market because I'm someone that I'm very, very risk averse. I rather do it through 401k. But I think it's very, very fascinating from a business perspective to look at the companies, look at the strategies that they have, whether they're going into a new market or trying to be the leader in their market, and typically I look at AOL, for example. When they came out, they were the leaders, right? But they were using telephone lines. They didn't think very smart in terms of cable lines and files. And guess what? They were overtaken by the Verizons and others.
Right, right.
So as a leader, whether it's in nursing or in business, you got to be on top of your game. You have to read. You have to keep up with what is happening.
Right, right.
Um, so anyway,
How has it been beneficial? You're now in a leadership position. How has it been beneficial? Because um, I can imagine it would from a director position or a managerial position, having
mhm,
that sense of business really comes in handy. Because I know sometimes we see uh, a, a, like a large number of people with MBAs getting
mhm.
hired for leadership positions, especially in the ambulatory care setting where it's more
Yes,
business minded driven,
focus.
right? It's usually for profit type
Mhm.
of a thing. How has it helped you from a leadership position having that MBA versus another degree?
Yeah, I think it helps to some extent. Again, being very, very able to read the financial statements, what are the variances, actual versus budgeted, right? What is the bottom line? And I don't want to, sit here and brag, but for our division, over the years, I've been there, every year we're in the black. There's not been one single year that
Yeah.
we have not been. We run a very mean but very productive, division, and, it's, again, I want to balance, right? It can't be just about business because we also have to remember the people that we're working with are the people that make the business run, right?
Yeah.
So it can't just be cut, 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 right?
Right.
How do
Right.
we also manage, take care of them, make sure that their needs are met at the same time while also trying to make sure that safety is being managed appropriately? So I think the business degree comes in hand. I wouldn't say it's the end of it all, but it's very definitely valuable,
It's an
right?
edge.
It's definitely an edge
Yeah.
that you have that you can quickly in your head. I'm able to spin numbers and discuss discussions with people, and they look at me like, "Wow, do you have like a calculator in your head, or how do you come up with these numbers?" And it's, again, I'm a numbers guy. I love
Yeah.
numbers.
Yeah, and I think that's one thing. I mean, when you think about it, I really wish I think nursing was more numbers focused at some
Yes.
point, especially in
Hmm.
leadership positions, because the people that you sit down with at those committees and meetings,
Hmm.
those are the bean counters, right? They're the
Exactly.
so if you can
Exactly.
speak the same language, because a lot of them don't speak healthcare, but if you
Yes.
can speak numbers like they do, I think you have
Yes.
advantage over them in making sure you're getting what you need.
Absolutely. I mean, you're right on the point. If I was a dean of any university, school of nursing,
Right.
my undergraduate and graduate level, they would take a business class.
Yeah. I think
Yes.
that's so important. That's so
Either,
important.
yeah. And for the undergraduate, we don't want to bore them. Maybe a class on budgeting,
Yeah.
a one credit or two credit class on budgeting. How does budget?
Yeah.
And for the graduate level, maybe the three credit class, about how you manage a budget and whatnot. But the moral of the story is this: a lot of times in nursing, and this, we take clinicians and we put them in a business, like a manager, and some of them, they're really good in the clinical setting, but they don't have the business mind, right? So
Right.
they argue about why we can't get this, and that,
Right.
till infinity. But what you have to recognize, again, it is a business product, right?
Right.
So you got to make sure that the bottom line, you're not cutting corners. Patient safety is held to a very high esteem. But at the end, there's also a little bit of resources so that we can continue to pay premium pay when we need to, buy the equipments that we need to, and continue to grow from that strategic viewpoint.
Yeah, that's an excellent point. Um, yeah, so maybe I'll invite you to guest lecture at one of my leadership classes on business. So
Without a doubt, without a doubt.
that would be fantastic
Absolutely.
because I think I had some of those same arguments. I'm like, why can't I have this when I need it?
Absolutely, absolutely. And let's talk a little bit about COVID. I don't want to divert, but
Yeah,
even in
yeah,
this COVID age, right, on the units, again, preaching to them that the hospitals, if you look at it, children's hospitals, bad and good. We had some kids that had COVID, but the numbers are small, right,
right,
compared to adults. This is affecting a lot of adults.
right,
So in this age, we have to really manage very carefully, right? So, it's even more like our business entity. We have to really talk about how we manage strategically well, because it's
right.
not like we're getting all this money. Pre-COVID, I was always full, and I have the privilege of doing whatever the hell I want to do. Excuse me. But today, I really have to, dot my I's and cross my T's because I have only limited resources available to me. The hospital is saying, well, it's not business as usual.
Right,
We don't know what the future holds. So you have to hold the line. So you
right.
have to be extremely careful. And
Yeah, I
this is
know.
where, you really, sit down and ask yourself, okay, so where are the, areas where we can make amends, and where are the areas that it's non negotiable?
Right. I know.
Absolutely.
I know. I have some people that I know work at several children's hospitals that I know those hospitals made significant cuts,
Hmm.
like from salaries, from personnel, just because during the COVID times their numbers went really low, and the
Yes.
same money was not coming into the institution. So,
Yes, yes.
so yeah,
I'm very proud of Children's Hospital. We have not laid one person off.
that's
But
fantastic.
one
That's
thing they've
fantastic.
asked us is that, look at your bottom line in terms of
Yeah.
your expenses, and if there's anything that you can do, definitely do. For example, traveling. So of course, COVID, we can't travel.
Right.
I had the privilege to, potentially travel overseas to do some talking. We couldn't go because of
Yeah.
COVID. I mean, so not one, two, or three people. I mean, that's also savings for the hospital.
Yeah.
And we're also being asked to, when you don't need to, if you can give some time, whether it's unpaid or some time off that you can take. So there are a few things that we're doing to help the hospital, and I think
Yeah.
that that's really helping us out.
Yeah,
But
I mean, if he can save jobs, I mean, I'm sure everybody's willing to
absolutely. And,
chip in.
for example, pay raises, right? I mean, we all can forego a pay raise in this hard times
Yeah,
for a year or two. I mean, if someone told me you won't get a pay raise, but I'm not going to lay you off, I'll keep the pay raise, and I'll keep my job
yeah,
any given day.
yeah.
Absolutely.
Hopefully things will be back
Oh, yeah.
to somewhat of a normal, and everybody
Yeah.
gets their pay
We're,
raises.
we're, we're very, very optimistic. We're
Yes,
highly optimistic
that's
that
fantastic.
if the trajectory with the vaccines, the
Yeah,
way they're going right now, if we can only hold steady
yeah,
for a month or two more
yeah.
without opening a lot of the US, I think that we're on the rebound and the future
Fingers
looks bright.
crossed. Fingers
Absolutely.
crossed.
Absolutely.
Yeah, the hope is definitely there.
Absolutely.
So let's talk about a little bit about leadership,
Hmm.
and how you ended up in the leadership role, and then I
Hmm.
definitely want to get into the work that you've been doing with restraints and the seclusion, because
Hmm.
I'm very impressed with that, and it's
Hmm.
something I think is so necessary across the board, from children all the way to adults. So talk to me
Absolutely.
about how you got involved with leadership, and then we can
Yeah.
get into the rest.
So I think I'm one of those people that my path was a leadership path, because after 2 years, I was already in the supervisory role.
Yeah.
And then once I did that for about 3 years. So by the time I left Hopkins as an entity, I had already had 5 years under my belt. I was vested. And so I started to then moonlight as I worked through graduate school, because I wanted the freedom of not having to wake up in the morning and go to a job 40 hours, and that was going to interfere with my ability to go to school. And so I worked around my, school, and I actually took almost part time, about 9 credits. I would do like um, the spring. before the spring break, there's like like early part of December, January 2nd through like before the semester will start. I'll take like a 3 credit class.
Mm,
And then the spring semester, I'll take 2 classes, which is about 6 credits. And then I'll go to summer school. And
right.
then I'll go back to the fall. So I was in school from January through December, pretty much. But it's so I think after that 3 years in the supervisory role, and when I went back to get my MSN MBA, I think for me, the next trajectory was managerial. So when
Mm,
I went to Children's, I went in as a manager. I went in 2004, and I was a manager from 2004 to 2009. And it was funny because, as you all know, 1 to 3 year goal, and then 3 to 5 year goal. And I was at the cups of my 5 year goal when I moved into the director role. And so I've been a director now almost since 2009, almost 12 years. And right now, yes, I wouldn't mind if the right opportunity came, yes, to move to the VP level. I think definitely something that I'll consider. But having stayed in the local Maryland area, situated here, you know, um, I work for myself, that I own a business in real estate that I manage myself, in addition to working at Children's, in addition to teaching. So, I have my hands full on any given day. So that has kept me in the director role because, you also know with the VP, that means you have 5, 6, 7 different units under your, it's a little bit more headache.
yeah,
So, right now I only have 2 units. It allows me the ability to do different things.
right, right.
I have the adolescent unit, I have the child unit, I have a manager that reports to me,
Yeah.
I have physician staff, that I work with fellows, residents, and as part of the leadership team for Division of Psychiatry. I think I'm very well positioned to move to the next level. But I'm content, if you ask my opinion,
Yeah.
where I am right now. It's not because I can't move up, but that means it's going to require more of me,
Yeah.
and then that may take away my ability to teach, my ability to manage my own small enterprise that I'm doing on the side.
Yeah.
So I'm very, very content, but it doesn't mean that if the right opportunity came, if an Apple or Google came calling, certainly I'll
But
consider.
that's a really great point. It's not, you have to figure out at what point in your
Mhm,
life you have to say, you know what, I'm good here
mhm.
because of that. But exactly what you said is like, because I can do X, Y, and Z
Z,
also.
absolutely,
I mean, like, it's not
absolutely.
the matter of not having the ability
Hmm.
to move
Hmm.
up in role or pay or anything like
Yeah,
that.
yeah, yeah, yeah,
What
absolutely.
does that take away from my life right now if I move into that role with additional responsibilities, additional, it's going to need more of me. Anytime you move up in the world, and somebody's willing to pay you more, there's usually they're paying you for your time, so it's going to need more of
Yeah,
your time.
yeah,
That's a
and I think for me that is the part that I'm very, very careful about. You can make so much money in this world, especially
Yeah,
with this MBA combination, if you get to some of these companies, but you also can lose your soul.
yeah,
So
so true.
I also appreciate um, my ability to volunteer at Hopkins, work with students.
Yeah,
I mean, it's been a niche for me. To whom much is given, much is required. I'm sure you've heard me use this phrase before. And I always want to make sure that the future leaders were able to mentor them and help them. So, being able to do all of these small little platforms means the world to me. Again, it's not because one can grow, and there's a saying, what does it give a man to gain the whole world and lose his soul,
yeah,
right?
very
So
true.
it's not just about the money, it's also about what can I give back tangibly, right? And I also make the argument, some people write like Bill Gates and others, and the gentleman from uh, the mayor of New York, what's the guy's name, Bloomberg, right?
Bloomberg,
They write 350 million. Of course, I can't write that kind of check. But
yeah.
there's also something valuable about me giving my time
Right.
and spending the time with a nursing student, looking at their resume, giving them cues about how to interview, how do you move from your leadership class into the professional realm. Because I think that as much as nursing schools do a very good job, there's a bit of a gap. Now I've graduated, I have that license, I have my full-time job, I'm going through preceptorship. How do I move from that space to then 6 months in, 1 year in, now I have a lot of experience? That gap, managing and helping them navigate and to recognize that there's a little bit of a gap, but it's highly doable.
Yeah, I definitely agree. Yeah, definitely agree. Um, so, so you're doing some incredible work. I'm not in the mental health world, but just looking at at what you've shared with me with your with the units that you work with. Talk to
Mhm.
me about the work that you're doing with mental health
Yes.
and
So,
restraints and all that stuff.
it's been very rewarding. I went to my job with one goal, and my number one goal was that for my legacy, when I left this organization, or with the day that I leave Children's, one of the things that I wanted to make sure that the kids have a good unit, a very beautiful unit that they can come and get a resting place as they heal. And that has been checked off. It was accomplished 2017, 2018. So I'm at peace. If I don't have to go to Children's tomorrow, I'm at peace with myself because that was one of the biggest goals that I set for myself. We had a $13 million renovation program that I led for our division, from breaking ground to the day that the project was finished, the CEO coming, having all the fanfare, opening it. It wasn't easy. I mean, so we went down from a 28-bed unit to a 20-bed unit whilst this was all being built. So we were still taking patients, and that's a very, very difficult place to be whilst you're building, taking patients, but also building at the same time, right? So it's sort of like you have two different jobs. You have the building job and you have the daily managing job. And so whilst this is being built here, it's a new environment, the workflow, all of that has to be dealt with because when you're ready to move in, you're ready to move in, right? You can't say, oh, well, we were doing business over here. This is what that looked like. Well, just take the same idea and move in. So that was a bit of a challenge, to say the least. But we were able to finish that. I actually presented some of this in Texas, Austin, Texas, at a conference about when you're building. And so that was a very, very good project. The next big project that I worked on is the suicide screening tool that we just got published. I sent you a copy of the article. It just came out last October. I mean, the pandemic of suicidality in the United States and around the world is extremely high.
Right.
And with COVID, it's even gone up a little step further, right? And I make the argument these kids used to go to school, they used to play sports, they'll have dates with their friends, they could travel with their parents and loved ones, right? All the kinds of stuff that they could do. They could go to a game, they could go to a musical event. Well, with COVID, yes, some of these things can be done online, but doing it online and doing it in person are two different concepts, right? So the kids are feeling very overwhelmed. And also, when you think about it, the parents are home. So a parent is on a Zoom working whilst the child is also trying to do Zoom to do homework. A kid with ADHD, I mean, the attention, how much attention do they have, even though when they're on meds,
Right.
right? So this has been a very, very difficult situation. So having that Columbia Severity Rating Scale that we started off, we did inpatient first, but we rolled it out to the whole enterprise. So if you walk into Children's, whether you're in the outpatient clinic or whether you're in the main hospital, they're getting suicide screening. And based on the screening, then we'll determine the interventions. On the medical units, if that were to happen, then they'll get a one-on-one. As a psych patient, automatically they get a one-on-one anyway,
Right.
right? But even if they are positive for suicide, that's a high-end alert to all of us that work within that division, right? And then in psychiatry, we screen the kids every day, all the kids. When I also built the new unit, we were able to put in bells and whistles. For example, I have an alarm on the door, so if someone is trying to hang themselves, the alarm will automatically go off.
Wow.
That will alert. And on my old unit, prior to coming to this new unit, I didn't have all of that. So again, when you build, I was able to put in, for example, I could turn off electricity and water. We have kids that will put lead pencil into the socket and that can start fire, right?
Yeah.
The people that set fires. You have kids that would stuff the toilet with socks and the toilet would start overflowing. I could shut off their water to their toilet. These were all things that we never had before.
Right.
Based on some of my experience, I was building, I was able to put this into the building. So we've done some really cool things that we never envisioned. We could have done this when I started. And then the restraints was my first love. I still haven't lost that, but that was my first love when I started. And I got exposed to that when I was at Hopkins for my leadership, my BSN program to graduate. I took restraints as something that I wanted to work on. And once I did that and I saw how much there was in the literature and how much, needed to be done, for me, that was something that kept with me. And I moved into my leadership. It was something that I held on. I had the privilege to present internationally and in the United States in terms of some of this work that we've done. So it's been great.
Now, tell me how you, from a leadership perspective, how did you take that reduction of restraint use? How did you take that and present it and have buy-in from the people that worked with you?
Yeah, so it's like I've said in some of our talks, it's the stakeholders. You have to engage your stakeholders, and the stakeholders are your division chief, right? The chief nursing officers, the quality people that we work with, right? When I got to children's, there was a whole different concept in terms of how kids were being managed. And having my exposure, I also had a director of medical director for the unit that also came from Hopkins. So our values sort of aligned, right? Um, they knew what they were saying before I got there. She was interested in doing. Actually, she's my division chief now. So we have almost about 17 years of working relationship.
Wow.
But when I started off, she and we were partners. I was the manager for the unit. She was the medical director. And given our background, believing in the ethos of Hopkins, from a safety perspective and how they managed, she did her psychiatry residency at Hopkins, training at Hopkins before she came to Children's. And I worked as a staff nurse at Hopkins. So, it was a no-brainer that we all knew that this is what needed to be done. So I'll say it makes it a little bit easier, but the people above you, apart from psychiatry, you have to convince them too, right? You have to tell them what you're doing. Exactly.
Align the goals, right?
Exactly. Align those goals and make sure that it also fits with the values of the organization. Where is the organization going?
Yeah.
And this organization goes somewhere and say, this is what they're doing in their Department of Psychiatry. And if you look at the literature, I mean, Massachusetts was a state that was doing some great work, right? The Harvards and the Yales, they were doing some excellent work. But when you come on the East Coast on this side, maybe Hopkins and some others, but it was far and in between. So how do you also put Children's Hospital on the map? Tell people the work that you're doing so they can begin to appreciate what is being done.
Yeah, definitely. And from the sound of it, you've taken the opportunity to spread the word, not just and I think that's one of the key things that I appreciate about most of the people I have the privilege of talking to is they share the wealth, right?
Yes, absolutely.
You share the knowledge, and I think that's key.
Yeah.
Definitely key.
We've had the chance. I mean, I presented this a while ago, but in 2010, I was a lead presenter at the American Academy of Child and Adolescent Psychiatry. This is a body of physicians, and I was a registered nurse presenting with some of my colleagues, work done by nurses presenting to doctors. I even got invited to go to Kansas to present some of my work. At it wasn't a full psych hospital per se, but residential. It was a residential that I had to go and present. And again, the work is doable, but a lot of time there's a culture that's ingrained, right? So the leadership has to be transparent, and we have to make it clear that we are willing and able to accept people for who they are. But we want you to declare that your practice in the past hasn't been evidence-based and that you're ready to convert. And we're willing to take you and lead you to a path of righteousness, which means that you're willing to do the work from where you came from and existed in the past. Now, this is the evidence, body of evidence. This is how business needs to be dealt with. And we are going to hold you accountable. How you practiced in the past, we're not going to hold that against you. But going forward, if you don't, we would. And if that means we have to get rid of you, we would.
Yeah,
Right.
I mean, accountability has to definitely be a component of change.
Absolutely. Absolutely. It can't be business as usual. Right. And I can tell you, even in my own department, there was some pushback. Some of the nurses, we've practiced this way. How dare you? You just came in today, new kid on the block, and you're causing a lot of waves. We never had all these problems. And, you know, you're definitely going to ruffle some feathers, but you have to stay the course and you have to engage them and say, guys, we could do better. And when we arrive where we need to be, we will be recognized and people will know who we are and people will be looking up to us.
And it's what's best for the patient as well.
Absolutely. Absolutely.
At the end of the day, our work is around that, as how do we make our patients or put the community in a better place than before. I think that's key. That's
absolutely. And there was a record. 130 kids had died because they were being restrained. Wow. Sometimes not being restrained the right way, or they were, being put in seclusion and nobody was checking up on them, right? So when we are embarking on this journey, we have regulatory that is asking us, you got to do a better job, right? But we also have to do well by the patients and their families. Right. I mean, that's our existence. We're not at this job just for the sake of being there. We're there to do well, to make sure that the child is being cared for and that they have a good experience that they can go. And if you look at the literature, if you put someone in seclusion or restraints, there's no body of evidence. Nobody can show me that says, oh, well, this is a scientific benefit that the child gets. Right. We do it because we don't want the kid to hurt themselves and hurt others. Right. But my question is, are there other ways that this can be managed? And if there is, then we have to look at it from that perspective.
Yeah, it should definitely be the very last resort.
Absolutely. Absolutely.
Yeah, unfortunately, a lot. It's more convenient to go to first or in early. Yes. It's more convenient. I agree with you. But if there's definitely any other way to do this, we have to definitely, I think from an adult perspective, I mean, it's the same thing.
Yes.
Is too quick on the draw with the too quick.
Absolutely. Absolutely. And when certain nurses work, seclusion is going to happen, right? Because they have their own way and how they bump heads. So there's a whole retraining, of the staff and for us, we also make it hard for them. We have a 6-page psychosocial paperwork that they have to fill out. The first page has to do with, did we do, it's a checkoff list, right? So it's very easy. The second page, we're collecting data and we're putting in a database, right? So if you come to me, I could tell you what time of the day, what age is likely to go into the restraints. I have all that data, right? So that's another piece. And then we have a debriefing form with the patient that needs to be filled out. It's 2 pages. Yeah. And then we have a debriefing form for the staff. Yeah. So when it's all said and done, it's about 5 to 6 pages that they have to fill out for every seclusion that happens.
Wow.
Right? So it's not just I'm throwing someone in there, but you also have to have the paperwork to back you.
Right.
And so if you can't, exactly, and you don't have the right paperwork and the justification, then we got to hold you accountable. Right. Yeah. So that was part of the resetting and letting people know, hey, it's not business as usual. In the past practice, they didn't even believe in, let's say, a little use of PRN medication. Like they would just put the kid in seclusion and close the door and let them be an hour or 2 until they're ready to depend on the age and the parameters from a regulatory perspective. And we changed that a child should be able to walk to you and say, Mr. Bannerman, I feel like I'm about to go off. I'm going to hurt someone. The demons in me, I'm feeling bad. Right. I need a small amount of medication to help me calm me down. I'm going to use my coping skills but I can also use a little small medication to help me with my anxiety to keep me calm.
Yeah.
Right? So having the audacity to go to a nurse and ask that, I think is a privilege for the child, but it's their right. It's their God-given right.
All right. And
Right?
it's empowering the patient, right? You're empowering
Exactly.
the
Exactly.
patient to advocate for themselves.
Right. So it's a last resort, but the patient can advocate. The patient can come to you and request that. Versus, oh, well, we put them in there, and then when they're calm, we take them out without any of these resources.
Yeah. Yeah, it makes sense. It makes sense.
Absolutely.
Now you're working on some new stuff.
Yes.
What are you working on now?
Well, new stuff, new kid on the block. So the latest thing that we're doing, and I think it's really kind of cool, is that when COVID started, some of our patients that have COVID, of course, they can't be in the general setting on the psych unit. But whilst they're waiting to be cleared, quarantine, and all that, we believe that they have the privilege to still benefit from care. So one of the things that we're building, and hopefully we'll collect some data, get it published at some point, is to make sure that they're able to attend groups. So we're looking at the possibility of using an iPad or a digital tool that they can join us from an inpatient bed on the medical units and be part of our group process. So that's something that we're working on. So I think one thing that I think COVID, very, very bad, but one thing we've learned from COVID is that we can really take the virtual platform to a whole different level. So now that we've learned that, how can we branch out using the virtual platform to begin to engage patients wherever they may be, right? Before you and I, even to do this interview, I mean, I may have to fly to Cali or be in Cali for business and then link up with you to do the taping, right? But look at today with Zoom. Look at Zoom. I mean, how Zoom has changed us in the last year. I knew about Zoom through Hopkins, but it wasn't that big. And today, Zoom is huge. I mean, so that's the next level, taking psychiatry to a whole different level. How can I engage a patient who may not be on my unit, but they can still benefit from psychiatric care? And that's what we're working at.
Wow.
How we make that bigger and better.
That's fantastic.
Absolutely.
Yeah. So we're about out of time. I want to definitely thank you for being here. Anything else you want to share with us? Advice for our nurses out there that are listening.
Yes. So you got to think outside of the box. A few things I'm going to say. You got to take care of yourself. So figure out a way to manage your stress, whether you cook, run, music, writing, journaling, whatever it may be. You have to find that niche, because the work that we do is a very delicate work, and something that maybe in the future conversation with you we can touch on. Even the nursing profession. I went to present at Hopkins, and I found out that some nurses are actually also hurting themselves and thinking about committing suicide. There's help on the way.
Absolutely.
1-800 suicide line, and they will help you. Certainly, so that's something that we definitely have to, pass on that message. The work is very stressful, and we have to get our nurses, we have to get them in a place that they're safe to talk about their own mental well-being and that the impact that it has on them. So I think that's something that is worth looking into as we move forward. But certainly, from someone who likes business, for your first paycheck, for you all new nurses, have a budget. Don't blow your check. Live within your means, right?
Good
because
advice.
Suddenly, and then if you have the means and you can buy a house or do something like that, we want you to invest in your own future, because at the end of the day, that's what it's all about, but critical to have a budget and live within your means. Exercise, mindfulness, yoga, whatever it takes, because we have to be balanced when we come into the clinical setting, from all the stuff that we go through, the stress. And you can't do a great job when you are not balanced. So that would be my big advice to them.
That's fantastic. That's excellent advice. I wish I had gotten it when I had graduated.
Absolutely. Absolutely.
Well,
Well, I want to Thank you, Dr. Ali, for hosting me. It's been a privilege, and I look forward to you and I working on some more projects where we can do some volunteer work and bring more people to, make them aware about some of this work that we're doing.
That'll be
So thank you for
fantastic.
hosting me.
That would be fantastic.
Absolutely.
Thank you so much for being on the podcast. We have been listening to Reginald Bannerman, Director of Nursing and Services and Psychiatry at Children's National Health System. Thank you so much for being on the show. And I wish everybody a great and fantastic rest of your week. Thank you very much.
Thank you, Dr. Ali. Much appreciated. Thank you much.
You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.